Healthcare, Clinic and Research Center. Get well soon.
Today we're going to talk about in a nutshell about diabetes. As we know, diabetes is one of the leading causes of death and disability across the globe, and in particularly in India. Currently there are about 7.4 crore people suffering from diabetes, and it is projected that by 2045 there will be about double this number who will be suffering from diabetes. And you know, diabetes is the leading cause of death, and hence we need to keep the diabetes under good control. So what do you mean by good control? Good control, we always look at the fasting sugars, the PPBS, and the HbA1c. Now the fasting, as we know, it's tested in the fasting, and the postprandial is usually 2 hours after your breakfast. And the HbA1c, which is the most important test we use in practice, is to determine your previous 3 months average blood sugars. So that is the most important part of your diabetes check. You need to keep your HbA1c below 7% to call it as a good control of diabetes. So once HbA1c is 7% and below, that means you are in the safe zone when during the diabetes management, and every 1% increase in your HbA1c will actually double your cardiovascular risk. That means the risk for strokes and heart attacks usually doubles following HbA1c 7 to 8, 8 to 9, like that. Every 1% increase will harm yourself. So what are the complications of diabetes? They can be divided into microvascular and macrovascular complications. Now the macrovascular complications are large vessel diseases, which includes your brain, your heart, and your feet. As we know, diabetics are about 2 times more at risk to develop the cardiovascular risk, that means the heart attack risk, and they are about 5 times more risk to develop the stroke risk. So this is an important factor which is preventable. Most of the diabetics, they neglect during the initial stages of their disease, and they try to repent later, which we see in clinical practice. Every day the patients come with something or the other as a complication. And you know, in India, the other complication which I was talking about, macrovascular complication, is about foot related problems. The commonest cause of foot amputation, that means removal of a limb or a toe or a finger, is in India is diabetes after the road traffic accidents. So it is very, very important. These are all the 3 major macrovascular complications which are preventable by tight control of diabetes. What do you mean by tight control of diabetes? Keeping your HbA1c, that is your 3 months average, below 7%. Very, very important that to keep it. So you need to ideally check this once in 3 to 4 months, at least once, and keep your HbA1c below 7% through strict diet, exercise, and treatment regimens. To tell you another fact, 50% of the diabetics are not under good control. They don't achieve their target. In spite of going to doctors, in spite of taking medications, in spite of taking diet and exercise, the so-called, the patients claim that they are doing all diet and exercise, but when it comes to the control, 50% of them fail to achieve the target, which is a very, very alarming situation. About 1.1 million people have died in 2017 in our country because of diabetic related complications. That is an important point to ponder, because this is something which is all preventable. Mind you, this is a preventable lifestyle related disease. It is not the medications which is going to help you. It is your lifestyle, which comprises of diet and exercise, which is going to prevent or postpone your complications. Now micro means small vessels. That is your kidney, eyes, and nerve fibers. Now kidneys, as you know, a lot of people would have seen their kith and kin undergoing dialysis, which is one of the commonest complications. It's a slow poison kind of thing which progresses over a period of time. Again, kidney disease is preventable, like your heart disease, like your strokes, by better control of diabetes. So it causes something called as irreversible kidney damage, end stage renal disease, what we call, and ultimately eventually patients would require dialysis, and dialysis cannot be coped up in a weekly basis, alternate days, weekly 2-3 times a day. Is again a laborious procedure, and ultimately would require a kidney transplant, which is again a very, very difficult task in our country now because of the donor issue. We don't find the donors properly and timely. So end of the day, the kidney disease, once somebody sets in, it's like they are on the deathbed. So you can definitely prevent diabetes and related kidney complications by better control of diabetes through diet and exercise. Again, I am emphasizing the fact it is the diet and exercise which matters the most, not your treatment alone. Now coming to the eye problem, the early cataracts are seen in diabetics. There is something called as a glaucoma, which is a raised blood pressure inside the eyeball. That is something again very commonly seen. And permanent blindness because of the retina damage because of poor control of diabetes. Again, imagine yourself becoming blind and having all the other organs and functioning well, and you are useless like a vegetable. Literally, you need to lie down in one corner. That is something again preventable. And coming finally to the nerve fibers, the fine fibers of the nerves get affected because of again poor control of diabetes. In the feet and hands are the commonest symptoms. This is one of the commonest presenting complaint or complication of diabetes. In practice, what we see, it's called as a neuropathy, where there is a tingling, numbness, jum sensation in the feet, worsening these symptoms in the night, so people don't get good sleep. Again, their circadian rhythm, that sleep cycle gets disturbed, so everything goes haywire. Their BP increases, sugars are not well controlled, they tend to sleep in the mornings where they're not exercising, so it's a vicious cycle. So please do not neglect your diabetes. By doing proper diet and exercise, you can bring it down to below 7%. Keep your HbA1c target. And what are the lifestyle changes which I'm emphasizing is, obviously your lifestyle has to be pakka, that is very good with respect to the timings of food intake and small frequent feeds. What I really emphasize on is the timely food intake and small frequent feeds, two things which you should keep it in timely manner, and avoiding direct sweets, avoiding fried stuff, regular exercise 20 to 30 minutes per day. Regular exercise, what I mean is not joining a gym. You can do as simple as walking 20-30 minutes in your garden, in your terrace, in your any time of the day. Again, people have got misbelief about the exercise part, that they have to do it only in the early mornings. It is not a must. You can do any time of the day, but 20 to 30 minutes per day, regularity is most important. And of course, quitting smoking, quitting alcohol is another factor which definitely adds on to your calories. And having junk food and timely eating food habits, timely sleepiness, early to bed, early to rise, what we say, please follow that. And through this diet and exercise, lifestyle changes, only with your support, a doctor can help you to bring down your sugars, and not by taking insulins, not by taking tablets alone, you will not end up having complications. You will definitely end up having complications if you do not follow all these three basic pillars of treatment, what we call. So kindly do the diet and exercise in a timely manner. Follow up with your doctor as your doctor advises. It's not a must to meet a doctor monthly. Once in 3 months, once your sugars are stabilized, once your BP is stabilized, you need to look at in a bigger picture. You need to control all other complications like cholesterol, like hypertension, like heart disease, like kidney disease. Regular checkups once in 3 months, once in 6 months of all these complications, we can detect by just simple urine test your kidney, early kidney involvement. That means early kidney damage can be detected by a simple urine dipstick method, what we call microalbuminuria. By yearly once eye checkup can prevent your blindness. Yearly once ECG can prevent a future heart attacks, or a treadmill or a echo test. These are all there when you regularly follow with your doctor, regularly follow with your diet and exercise. These are all preventable complications. So please stick on to the diet, exercise and the treatment.